Hi, and welcome to this next webinar by Skintellectual Solutions. And today we're going to be talking about principles of retinol skin treatment, diving a little bit further into this amazing molecule, retinol. Dermatologists know the famous Klickmann's gold standard for hyperpigmentation treatment with tretinoin. Retinoids can induce changes in melanocytes arrangement in the skin and melanin distribution. Can retinol be effective for skin bleaching as tretinoin? The Japanese study of melasma demonstrated that high-dose retinol together with hydroquinone, like in Klickmann's formula, improved hyperpigmentation in 88.9% of patients with excellent and good results. But please note the dose of retinol in the study was high. Probably less doses, lower doses, can be effective, but with better tolerance and fewer side effects like scaling and irritation. So for who can retinol be prescribed? So the first choice is photoaging symptoms, regardless of the age of the patient. Retinol can be added as a pre- and post-skincare to procedures targeting collagen stimulation and hyperpigmentation in the clinic. For example, lasers, peels, diluted calcium hydroxyapatite, microneedling, etc. Retinol is the skincare choice for rosacea patients and patients with elastosis. Retinol can be successfully used for striae treatment and body skin laxity. So this, of course, is a picture of a clinical picture of photo damage, as you can see. So what to expect from treatment with retinol? What can we tell our patients? On a structural level, there is a thinning of the stratum corneum, but there's a thickening of the dermis and the epidermis. There is increased dermal collagen deposition, there is neovascularization, and more even melanin granules distribution. Clinically, the patient observes skin texture change with a smoother and softer skin, fine wrinkles decrease, there is kind of a pink, healthy glow, and a decreased sallowness of the skin and improved pigmentation. However, such morphological and clinical changes are more characteristic of retinol and tretinoin and less likely for derivatives of retinol. Derivatives of retinol are very attractive in cosmetic industry because of their safety profile and stability in cosmetic formulations. But unfortunately, they didn't show the same efficacy as tretinoin and retinol. And therefore, studies showed that retinyl palmitate, for example, penetrates the skin much less easily and induces less metabolizing retinoids and the retinoid enzymes than retinol and retinoic acid, tretinoin. In the other study, biopsies of the skin treated with complex of retinyl palmitate with peptides and antioxidants, although showed deposition of fibrillin 1 comparable to retinoic acid. But if this effect can be attributed to retinyl palmitate is unclear because of the high concentration of other stimulating collagen ingredients, like the peptides. Finally, retinyl propionate didn't demonstrate clinical efficacy over placebo in the double-blind randomized long-term study. And you have to also know that some companies make misleading claims, marketing derivatives of retinol by stabilized retinol, which is of course not retinol, but something else. Here, Dr. Goldman compared his own two studies with two different concentrations of retinol and concluded that more concentration, 1%, is more effective than less concentrated, 0.5% of retinol. But both improved crow's feet and other wrinkles. They improved skin elasticity, they improved mottled hyperpigmentation, and they improved skin texture significantly. So, principles for retinol treatment are: more concentration is more effective, but high concentration increases the risk of skin irritation. Meanwhile, skin irritation can be observed on subclinical or mild level on all concentrations, and it can be a sign of therapeutic response. It's for my patients, when I explain this to my patients, I tell them that when you have some side effects, when you have some irritation, it means that it works. So the art of retinol skin treatment is to balance between retinol concentration increase and tolerability irritation by titrating the retinol dose. Patient assessment to predict the risk of irritation and consultation are crucial in compliance of treatment. To avoid the risk of irritation, mass media cosmetics contain either a low dose of retinol or derivatives, or retinol would reduce the activity of the treatment. And therefore, it may not be as effective as with a good titration of the dose of retinol. So how to avoid these side effects during the treatment with retinol? First is to diagnose and target risk groups of patients before the treatment. In this group, slow dose escalating treatments regime should be prescribed. Also, it's important to avoid any irritation triggering factors during the initial period of dose escalation. And of course, you have to keep in mind that there's a specific delay of a few days after application of the product. If irritation occurred, patients should make a break for 2 to 3 days. Intensive moisturizing care helps to reduce the dryness and feeling of burning, together with the avoidance of any skin irritants. Please note that irritation occurs typically after 3 to 5 days from the application. Meanwhile, the skin adapts to the applied concentration and signs of irritation become less. Subclinical irritation demonstrates good skin response on retinol treatment, and the art of retinol treatment is to control subclinical irritation with titrating the dose of topical retinol. Retinol treatment demonstrates first signs of clinical improvements after 3 months, and that is of course important to tell our patient. The effect is growing with the maximum of month 12, and therefore it's important to manage patients' expectations regarding the duration of treatment and first visible results. They have to continue, they have to go through that irritation to get to their clinical end result. Topical retinol is considered safe for skin application during pregnancy. Meantime, precaution is required, and retinol use in the first trimester of pregnancy should be avoided. Retinol skincare enhances the results of procedures if it's incorporated in the pre- and post-treatment plans. So pre-treatment, before peels and lasers, results in a faster re-epithelialization and recovery. Post-treatment gives more clinical improvement of treated symptoms like pigmentation, photo damage, or acne. And of course, combination is key. It's always the best to use different combinations. And of course, retinol, it has a place, deserves a place in any combination strategy on skin quality improvement. Skintellectual retinol has high activity for skin treatment. One microemulsion with particles of size less than 10 nanometers gives good penetration. The Hylosphere technology stabilizes retinol and maintains concentration of retinol in the stratum corneum for 6 hours. So there's basically a slow release. And 3, additionally, Hylosphere technology provides the hydration due to the high concentration of hyaluronic acid. Patient consultation is crucial for compliance of retinol skin therapy. Manage patient's expectation. Present the main targets for retinol treatment. Inform your patient about the duration and the first signs of improvement. Educate about difference between physician retinol prescribed treatment and mass media cosmetics. Prevent patient dissatisfaction. Inform about the risk of irritation, the irritation phase of the treatment, then also the getting used to the retinol, so there's a reduction of irritation, but during the irritation phase there can be some scaling, there can even be an increase in acne symptoms. To prevent complication, skin protection should be advised. We have to highlight the importance of moisturizers and recommend avoiding the use of irritants to the skin. We have to motivate the patient. We have to explain the science behind the retinol treatment, which is the only FDA-approved and most proven, best researched anti-aging skin ingredient. So that brings us to the end of this dive deeper into retinol technology by Skintellectual Solutions. Thanks for watching.